I think I'm having a heart attack.
Jerry!
According to the CDC, every 43 seconds, someone in the United States experiences a heart attack.
However, heart attacks, also scientifically known as myocardial infarctions, do not always have recognizable symptoms. While a vast majority of people will experience traditional symptoms, there are a subgroup of people who will experience atypical or no symptoms at all.
So what exactly is a heart attack? What are its pathological effects? And how do we recognize its symptoms?
Let's examine these questions in greater detail.
Heart attack occurs when the heart don't receive oxygen through the blood. It's one of the most common when there's a clot in the heart. Then what occurs is the heart which don't receive blood can result in a cardiac arrest when the heart doesn't pump blood for the body, for the whole body, especially for the brain that needs oxygen. There's another important thing is the time, because one patient, one victim who doesn't receive cardiopulmonary resuscitation, for each 1 minute, this victim will lose around 10% of chance of survival in the end.
A heart attack occurs when one or more of your coronary arteries become blocked. Over time, a coronary artery can narrow from the buildup of various substances, including cholesterol. When plaque builds up in the arteries, the condition is called atherosclerosis. The buildup of plaque occurs over many years. Eventually, an area of plaque can rupture, break open inside an artery. This causes a blood clot to form on the plaque's surface. If the clot becomes large enough, it can mostly or completely block blood flow through a coronary artery. Without blood, the muscle is starved for oxygen, causing damage to the heart muscle. The heart attack occurs because the damaged heart can no longer pump properly. There are a number of symptoms that are indicative of a heart attack.
Intermittent discomfort or pain in the center or left side of the chest is one of the more common recognizable symptoms. The pain can even sometimes radiate to the entire upper body and cause discomfort in the arm, shoulder, or neck area. Another key symptom that is also suggestive of a heart attack is the combination of these symptoms with shortness of breath.
While a heart attack is best dealt with immediately in order to minimize after effects or permanent damage, that is not always possible. As a result, many are left with conditions such as arrhythmia, permanent muscle or brain damage, permanent heart damage, increased risk to future heart attacks, and more.
Heart attacks are an event that can strike anyone and are deadly, especially if left untreated. But there are some factors that are known to increase the potential of receiving them.
Let us go ask a professional just to see what kind of factors play a role in increasing the risk of a heart attack.
So in terms of cardiovascular risk factors, there's two types, modifiable and non-modifiable. The modifiable risk factors are things like blood cholesterol, hypertension, diet, coronary artery disease, things like that. And non-modifiable risk factors are things like genetics, your age, your gender. So we find that males actually have a higher incidence of heart disease, and as you might imagine, age also increases the likelihood of heart disease.
What are the current treatments for in and out of hospital cases?
The most common rhythm, cardiac arrest rhythm, in the out of hospital environment is ventricular fibrillation, which is very important. You defibrillate the heart. That's why we have the automated external defibrillators in a lot of places, for example, airports, shopping mall, gym. So that's why it's very important. Even lay people be trained to perform cardiopulmonary resuscitation to prevent bad neurological outcome in the end?
What we're doing is studying these two devices, the impella and the lucus, and just a quick little background info. The lucus is an external mechanical piston-based device that maintains hemodynamics through compressions. The impella is a left ventricular assist device, so it's a catheter-based device that we place into the left ventricle, and that maintains hemodynamics by squirting blood into the aorta. So what we're doing is we're looking at these two devices, and each of them has been shown to improve outcomes in the case of cardiac arrest. And basically the main goal is to just keep blood pressures to an adequate level so that the brain is being perfused.
All of the questions and answers we have explored have led us to inquire new questions.
Such as, how is neurological function affected when using the Lucas machine versus the Impella and manual CPR? Can heightening intraoperative and postoperative care improve the prognosis of cardiac arrest both in and out of hospital cases?
Advancements in research and medicine will allow us to potentially answer and informative questions as well as open more rooms for future